1. First stage, dilation of the cervix. This is the longest stage of labor, starting from the onset of regular contractions and ending when the cervix is fully dilated, 10 centimeters. A. Early labor, latent phase. Duration can last several hours to a few days, especially for first-time mothers. What happens? The cervix begins to soften, thin, efface, and dilate from 0 to 3 centimeters. Contractions. Mild, irregular contractions are common, lasting 30 to 45 seconds, spaced 5 to 30 minutes apart. They might feel like menstrual cramps or lower backache. Signs. You may notice the loss of the mucus plug or a small amount of bloody show as the cervix starts to open. What to do? Stay relaxed, hydrate, and try to rest as much as possible at home. Unless your water breaks or contractions become regular and strong, you typically won't go to the hospital yet. B. Active labor. Duration typically lasts 3 to 8 hours. What happens? The cervix dilates from 4 to 7 centimeters and contractions become more intense, lasting 45 to 60 seconds and occurring every 3 to 5 minutes. Contractions. These contractions are more painful and regular. You may feel them in your lower abdomen, bath thighs. Emotional and physical changes. Many women feel more focused, and it becomes harder to talk or move through contractions. What to do? It's often recommended to head to the hospital or birthing center during this phase. Comfort techniques like deep breathing, massage, changing positions, and using a birthing ball can help manage pain. C. Transition phase. This phase is the shortest but most intense, usually lasting 15 minutes to an hour. What happens? The cervix dilates from 8 to 10 centimeters. Contractions are extremely strong, lasting 60 to 90 seconds and coming every 2 to 3 minutes. Contractions. You may feel the urge to push, but it's important to wait until fully dilated. Emotional changes. Women often experience strong emotions during transition, like feeling overwhelmed, shaky, or even doubt about continuing without pain relief. What to do? This is the most challenging part of labor, so focus on staying calm and listening to your body and healthcare team. Support from a partner or doula can be very helpful here. 2. Second stage, pushing and birth of the baby. This stage begins when the cervix is fully dilated, 10 centimeters, and ends with the birth of the baby. It can last anywhere from a few minutes to a few hours, depending on various factors, including whether it's a first birth. Pushing. Once the cervix is fully dilated, you'll start to push during contractions to help move the baby down the birth canal. Contractions in this stage may feel less painful, but the pressure will be intense. Urge to push. Some women experience a strong, uncontrollable urge to push, known as the Ferguson reflex, while others may need guidance from their healthcare provider. Positioning. You may try different positions for pushing, such as squatting, kneeling, or lying on your back with support. The goal is to find what works best for your body and helps the baby move through the birth canal more easily. Crowning. This occurs when the baby's head starts to emerge from the vaginal opening. You'll feel a burning or stinging sensation as the skin stretches, often called the ring of fire. Delivery of the baby. Once the baby's head is out, the rest of the body usually follows quickly. After the baby is born, the healthcare provider will ensure the baby is breathing and healthy. 3. Third stage, delivery of the placenta. After the baby is born, the contractions continue to help deliver the placenta, the organ that nourished the baby during pregnancy. This stage typically lasts 5 to 30 minutes. Placental delivery. Mild contractions help the placenta detach from the uterine wall. You may be asked to give a few gentle pushes to assist in its delivery. Monitoring. Your healthcare provider will examine the placenta to ensure it has been fully delivered and will check for any excessive bleeding. You may also receive medication to help your uterus contract and reduce postpartum bleeding. What to expect? You may feel some relief as the pressure decreases significantly, but there may still be mild discomfort or cramping as the uterus contracts. 4. Fourth stage, immediate postpartum recovery. This stage is sometimes considered part of labor, as it covers the first few hours after the baby's birth. During this time, your body begins the process of recovery. Uterine contractions. Your uterus will continue to contract to prevent excessive bleeding. These contractions, called afterpains, can feel like menstrual cramps. Breastfeeding. Initiating breastfeeding soon after birth can help stimulate uterine contractions and bonding with your baby. Monitoring. Healthcare providers will closely monitor you for signs of postpartum hemorrhage and other complications. Emotional and physical recovery. You may experience exhaustion, elation, or a mix of emotions as you bond with your newborn. Each stage of labor is an intense but natural process. The body goes through a lot of changes, and while everyone's experience varies, understanding these stages helps in preparing for the journey of childbirth.